Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Tuesday, December 6, 2022. It is the first Tuesday of the month. And as we've been doing for the past year or so, thanks to the support of the Massachusetts General Hospital, Office of Equity and Community Health, we are here today to discuss HIV and AIDS in 2022. And as a young teenager, I remember hearing about this infection. At that time, we were saying disease, and just hearing a lot that was unknown, and a lot of people were afraid, and the medical industry was trying to figure out what was going on. And so much has changed since then with treatment and also prevention. And so we have Dr. Sanchez with us this morning, who is faculty at the Massachusetts General Hospital, and also, I believe, the deputy director at the Boston Public Health Commission. She is an infectious disease specialist, I believe, along with her other responsibilities. That is her specialty. So we're going to get ready to bring her in because we want to ensure that we get you the most accurate and up-to-date information. I'm just going to refer to my notes every now and then, but we're going to bring in Dr. Sanchez. I told her when we were getting ready, she has a wonderful sort of radio voice. And so we are looking forward to welcoming you back into the Java Cafe. I believe this is your second or third appearance. Third?
I believe so. It's always a pleasure. Good morning.
I am so glad to have you here. And again, as she talks, you all can listen. She has a wonderful voice that's maybe you need to think about doing a podcast.
Maybe.
With Dr. Sanchez. But welcome to the Java Cafe. As we always do, you have an awesome responsibility taking care of patients, and then also your role at the Health Commission, which encompasses everything public health here in the city of Boston. So we'll begin with asking, how are you doing?
I am doing well. Thank you so much for asking. It is a time to reflect as we approach the holidays and
Yes.
and I think that's often, it's a time of reflection, I think.
For all of us,
For all of us.
Definitely, definitely. We're going to check in this morning, and we hope when we finish today that you will know the difference between HIV and AIDS, understand how it's transmitted, be aware of current recommendations for screenings. We'll talk about maybe some inequities there with the inavailability often of screenings and treatment, and talking about prevention. I'm sure we'll touch on PrEP. That seems to be a very popular. I'm hearing the young people and within some, subset communities. I'm on PrEP, and I've often said to them as a former youth worker, that doesn't, take care of everything. And so we'll also have a good understanding of what it means to be HIV and AIDS positive, HIV positive in 2022 versus as I referenced. And so, Dr. Sanchez, where are we in comparison to some years ago when we both were younger, the medical industry first started hearing about this? Where are we today in comparison?
I mean, we are in such a different place than when the HIV epidemic first started. And that is, many reasons, including progress in science and the advocacy, really, of our communities in fighting for scientific progress and access to tools and for people living with HIV. So much has changed, really, in the past 25 years. I would definitely, 20, 25 years, definitely.
Absolutely. And let's sort of take it back a little bit because we're saying HIV and AIDS, and we want to ensure and not assume that the viewers and everyone that will watch after understand that there is a difference. And so, can you first, and we're using acronyms, can we define what those acronyms are? First, HIV, and then AIDS, and then there is a difference there. And so, can we just explain the difference? Give sort of like a HIV and AIDS 101. And a lot of us learned a lot. A lot of us had to adjust because, as you said, it was a new sort of epidemic in, to the medical industry. And so we just want to ensure that everybody has the information still in 2022.
Of course. And I think I just want to, something I really want to highlight is
Yes.
we just commemorated World AIDS Day
And
on
that's why we're
December
doing
1st.
this today. Yes,
Um,
absolutely. A couple of days behind, but
correct. And but such a timely opportunity to talk about HIV and AIDS. And it was first observed in 1988 when we were really seeing a lot of AIDS related illness. And again, it really is a day that we really help to end HIV and remember sort of those lost at that time, and also just appreciate how far we've come. And so to break it down a little bit, the difference between HIV and AIDS. HIV stands for the human immunodeficiency virus, and that is the virus that infects individuals, that affects people with HIV. That virus attacks cells, and it really makes your immune system weaker. It makes your body more vulnerable to infections and other diseases. Now, so that's HIV, it's the virus.
yep,
Now, AIDS is that late stage of the HIV infection. And that's because if the virus goes untreated, it kills more and more cells in your body, and your immune system is very weak. And that leads to the AIDS disease, also known as acquired immunodeficiency syndrome, or AIDS. So a very weak immune system. And that is really when we saw so many deaths so many years ago. And we continue to see, although far less because of the tools that we do have.
absolutely. And what are one of the ways, Dr. Sanchez? Let's also kind of cover how it's transmitted. It's not just sexually transmitted. There are, from my time going back as a peer educator, and maybe a little rusty there. It's transmitted sexually and other ways. And so, how is it transmitted?
You are doing great, Jimmy. So you can get HIV. So, we've talked so much about how infections are transmitted, right? And that's
Yes.
so important to knowing and understanding our tools. So you can get HIV by coming into direct contact with body fluids that then get into your bloodstream. That's the gist of it. So, for
Yes.
example, and that's really when when you're in contact with the body fluids of someone with detectable virus in their blood. And that's important because we'll talk a little bit about how treatment
Exactly. Yep.
kills the virus in the blood, right? But, for transmission to occur, the HIV in these fluids must get into someone's bloodstream of an HIV negative person. And those fluids are often, we think of blood, we think of semen, rectal fluid, vaginal fluids, breast milk. And so that's why we think about sexual activity and injection drug use are often the most common ways, or needle sticks, of getting HIV in the United States.
Those were the two most popular ways, as I said, some many moons ago, as a peer educator. Those were two of the number one ways. And I want to sort of deviate just a little bit because you had come on, I believe we were talking about the vaccination or during COVID, and we were talking about some of the research that something with the antiviral, we got on the subject of HIV, and you talked a little bit about the reduction of stigma. There is still a certain stigma, but the reduction of it. And so, if we could just talk about that for a couple of seconds, that, early on, there was a stigma. I remember running into a nurse, and in the beginning, the unions and stuff were fighting. They were not, some didn't want to treat the patients and things like that. And so, where are we today by your perception? And when we talked, a few months ago about it, where are we today? So in case someone is listening, they need to understand that things have really, really changed.
Things have changed again so dramatically, not only with when it comes to treatment, but also, I think we have come a long way in really advocating against stigma. Not just staying silent, not just being indifferent, but really advocating against. So I would say that that's one of. I mean, I've in my years of medical practice, I feel like I've learned so much from the people living with HIV and the community of advocates really that have stood against stigma. I mean, at the onset of this epidemic in the 80s, there was such a huge amount of stigma, particularly towards men who have sex with men, and a fear of a very stigmatizing fear around getting HIV in ways that we now know you cannot get HIV, and we'll talk a little bit about that as well. Um, and we at the Boston Public Health Commission, actually, we with the HIV Planning Council for the Boston area, created a video, an anti-stigma campaign, really talking through how things have changed, such, and again, how we remain committed. I think we've learned so much from HIV that we now know in our public health work towards other diseases, and that we apply the same of really trying to advocate for those, really trying to advocate against stigma.
That was definitely the correlation between, when remember it came up, you referenced it before. So I wanted to make sure we highlighted that here today as well. So a lot of advancements have been made in treatment as well as prevention. You touched on it a couple of seconds ago when I heard you use the term undetectable, and we're going to talk about that. But let's talk a little bit about, and that's a little bit of prevention, but let's talk about prevention. Again, being a peer educator, the number one thing that we were going around doing as young people, one of the number one ways of preventing it is safer sex. And we used to go and give out condoms, at health fairs and things like that. So that is probably the number one public aware uh, uh, strategy to prevent it. But what are some other strategies? And here of late as well, Dr. Sanchez, there are some different prevention models to, help prevent the further spread.
That is so true. Today, we have more tools than ever available to prevent HIV. And I think a big part, and this relates to the stigma piece we were just talking about, anyone can get HIV.
That's right.
This is not a disease that just affects, men who have sex with men, our LGBTQ plus community, people who enjoy, anyone can get HIV. And we all, right, need to sort of take measures to both sort of protect ourselves, right? Like through, and we'll
Yes.
talk a little bit about that, but just importantly, again, to advocate, we're all in sort of all in public health. We're all in this together. So a few key things. If you're having sex, the most important ways to protect yourself, as you mentioned, Jimmy, are by using condoms the right way every time you have sex, and also using the right lubricant. So water-based or silicone-based lubricants to help prevent condoms from breaking or slipping is really important. You can also protect yourself by getting tested and treated for other sexually transmitted diseases. Treating them can lower your chances of getting HIV. If you have a sore on your penis or a sore elsewhere, that's where the virus can get to your bloodstream, as we talked about. If you aren't having sex with someone who is infected with HIV. And then there are sexual activities that have a lesser risk, such as oral risk. Oral sex, we typically do not, it does not transmit HIV, or sexual activities that don't involve that contact with the body fluids. Now, and if your partner does have HIV, really encouraging them to get and stay in treatment. That is incredibly important. Now, if you are injecting drugs, one of the main pieces of advice we say is never to share needles, and to really use new clean needles every time. If you have to share needles, we often, we do recommend that cleaning them with bleach can help, but really avoiding using shared needles is one of the main pearls. And one of the single most important things we'll talk about today to lower your risk of HIV if you're having sex, particularly, but also if you're injecting drugs, it does lower, is pre-exposure prophylaxis. And I think, Jimmy, that's what you were getting at. It's one of the most effective ways to lower your risk of getting HIV. It's a pill that people can take when taken correctly and taken every single day. It can really, it is highly effective at preventing HIV infection. So we'll talk a little bit about where we as doctors recommend it. I see, I use pre-exposure prophylaxis amongst my patients. But oftentimes, we think about it, particularly if, we mentioned condoms. Condoms don't work. Condoms, not everyone has access
And
to, or
correctly, and they have to be
correctly,
used
or
correctly or access.
yeah. So, oftentimes we think of this as a very important tool, and we're really trying to make aware amongst many, not just among, if people who might think, amongst everyone. We talk about pre-exposure prophylaxis amongst everyone, and we'll talk a little bit more about that. But men, women, we know that many people are at risk for HIV and they don't know it.
We can actually go into that now, Dr. Sanchez, because I'll always be a youth worker, and when I was taking public transportation, being around just young people at events, you kind of, you ear hustle to kind of get a sense of what's going on because, I'm not that young anymore. And I kept hearing this prep in this one conversation. And so it can we explicit that is the term for the what does it stand for? Again, remind me.
Of course, pre-exposure prophylaxis.
Exposure prophylaxis. And so that is something that you said you recommended to patients. When it comes to taking prep, there is a screening process, right? You do have to be tested first. Is that correct?
That is correct. So we can walking through it a little bit. It
Let's
again,
do that. Yes.
it's a pill. So this is a pill that people can take on a daily basis. And again, if taken correctly on a daily basis, it effectively reduces your chance of getting HIV. It is highly effective. Now, typically, um, and I just want to mention that it is covered by many and most insurance programs, and then we also have a drug assistance program here in Massachusetts to help any individuals that might be facing a cost to cover that cost. So again, we have very important, just practically speaking, here in Massachusetts, that's a great program. So again, covered by insurance, so should be at little to no cost. So it's a pill. We often have people. So in the clinic, if you're interested in prep, oftentimes we'd have screening tests. So we test for sexually transmitted diseases as well as HIV because we want to make sure that you don't yet have HIV. And we want to make sure that you're HIV negative. And then, and we do some blood work. Once that blood work comes through, you can get started. And the start can be pretty quick. It can be in a matter of days, really. It's not, there are very few barriers at this point. To prep and really oftentimes I counsel everyone who comes to to my clinic about prep and because it really we think about individuals who are sexually active,
Yes.
men and women. If you haven't consistently used a condom or sort of you've been diagnosed with a sexually transmitted diseases in the past 6 months, again whether you're a man or woman, if you've had a sexual partner that has HIV, or you inject drugs, or you believe that you are exposed and continue to be exposed to HIV. And again, I think many sexually active and anyone who's sexually active and might not consistently use a condom, prep might be a tool you might want to consider.
In,
Um,
in that vein, Dr. Sanchez, I've heard you use the term testing and screening a couple of times. Let's talk a little bit about that screening for HIV. And it's so interesting because I remember again being a peer educator there. Back then, we were saying STDs and HIV. Now we're saying, excuse me, STI, sexually transmitted infections. And so, how important? And I think again, though things are interesting, with COVID, there's still an impact from what we, dealt with a couple of years ago. And so, how important is it to be screened, pay attention? Because the other thing, and I remember this being a part of campaigns some years ago, there often aren't any symptoms of STIs. And so, as you said, if you're having unprotected sex, if you're using IV, intravenous, using drugs intravenously injecting, how important and how and where do you go to get screened?
so first and foremost, any adolescent and adult should be screened for HIV at least once. And we as doctor, we in the healthcare setting,
Really?
yeah, you should be screened for
If they're
HIV at
sexually
least once.
active, correct. If they've had any sexual activity or
We say that, many adolescents and adults should have an HIV test at least once, right? Because in some ways, we know that the most important, one of the most important factors to, staying healthy is that we diagnose people quickly, so like, and that people know, so many people don't know their HIV status. And so that's actually one of the main calls to action of World AIDS Day is really to go
know
get
your
tested,
yes,
know
that's
your status and go get tested. So every adolescents and adults should have screening for HIV infection at least once, right? So that's first, like bare bones. Now when we think about sexually active people who are sexually active, one of the screening recommendations is people who are sexually active should have HIV testing at least every year.
Okay.
particularly men who have sexually active men who have sex with men. That's because we know that particularly anal sex, it still remains at a higher risk, mostly because the tissue around the area is just can break easily, and so that's where the blood, again, when we talk about transmission, that's when you can bleed and sort of have more exposure to the virus. But I would say, just roughly speaking, if you're sexually active and you're having different partners, oftentimes I tell people get tested not only for HIV but STIs as well. Between partners or before you have a new partner, and so that might be more than annually. In fact, people who are on PrEP on that medication I mentioned, we test them every 3 months. Now, the CDC actually recently looked at trying to see whether people should get HIV testing more often than annually if you're sexually active, and they didn't see, didn't see sort of a global benefit. But I would just say, roughly speaking, if you're sexually active, I think getting a test and having different partners, either in between partners or annually, is a good bet. And I do think a big part of it is we know that if you have another STI, your chance of getting HIV is higher, right? So it's not just about getting tested for HIV. It's about getting tested for chlamydia. It's about getting tested for gonorrhea. It's about getting tested for syphilis. Um, so, really, many people should be testing far more often than they are. And I think that's a big call to action is just, get tested. We have sexual health clinics and primary care doctors also perform
Yes.
HIV and STI and, STI screening as well. Um, so, we definitely have access, to testing here in the city and in Massachusetts.
One of the things, Dr. Sanchez, that you acknowledged was that medical insurance will pay for PrEP, and the other that's a barrier often sometimes for people with treatment. Are you aware of there with all of this availability? Are you aware of inequities or imbalance in the awareness one of education and information? And it's so just this is just personal. It's so different now because when I was a teenager, the signs and the get tested and know your status, and you still see it, but it's not at the extent of what it was when I was younger. And I guess that's where my youth worker personal concerns come from, I'm taking PrEP. And as you said, there are other sexually transmitted diseases. And so what with that barrier of either being a teen or sometimes insurance limiting availability of access, in this case it does not, are there other barriers that you're aware of that folks will can navigate around to getting in the treatment or getting screened?
And I think we still have many barriers.
Yeah.
I think that we have the tools, but it's often about and the information, but it's often getting the tools and the information into the hands of people who need them the most and who are at higher risk. Now, historically, and still so, we know that people of color, particularly Black and Hispanic men and women, have often, we've seen far, higher rates of HIV, higher rates of HIV acquisition historically, and death rates too. There still remain large death rates. Particularly here in Massachusetts, we know that the death rates among Black and Hispanic and Latino individuals still remain 7 and 5 times that of white non-Hispanic individuals. So that is still a stark disparity. And I think that, it all that's in some ways why even talking about testing relates so importantly to that, right? Because
Yes.
the more that you get tested, the earlier that you know your status, the earlier that you get treatment and that you can stay in treatment. And that really improves your health overall. We know that people who get early treatment and are diagnosed early have a very, very can live sort of similar life, like same life expectancies. And that's often what we tell counsel people. But there's still, I think the other piece is staying on treatment. I think not everyone has support to take a pill every day. Many people have other things on their mind that are take
So
priority, like having food and having a roof above, or like where to store your pills, right? So I think that there's, it's oftentimes, you know, and access to a doctor, right? I mean, not
that's right.
everyone has access. I mean, it's primary care. So I think those are some of the few barriers that remain, that we are still, and that's one of the reasons being here today is so important, right? To sort of have it, get information out at the very least, to those who really need it, to everyone.
One of the other things that I wanted to name, and we talk about it on this platform generally, and with it's come up with your healthy Java as well, there is sometimes the barrier if a trans man or trans woman may go into a facility for treatment as well. And so we want to name that. And then when you were talking about black and brown, if you're black and brown, and then gay or trans, that barrier exponentially may seem very interesting. Another thing I wanted to say, and this is James saying this, and because we're partnered with MGH, I hope this isn't offensive to anyone. But when I was younger, Dr. Sanchez, if someone got an HIV diagnosis, it was reacted to as if it was a death sentence. Are we still there today?
We are not, and I think that's one of the also key messages that we know that with proper HIV care, with prompt treatment, people who with HIV who get treatment can live long, healthy lives, and they can protect their partners. We are at a very different place. So that's, I think, another, we often tell, when we have patients who are coming in with a new HIV diagnosis, that is often how we counsel them that, with proper treatment, you will live a long, healthy life, and you will die of something that is not related to your HIV, most likely, or not, you will not die from your HIV. So I think that is sort of an important message to convey. And you're total, I think that the stigma, we've come a long way, but as you mentioned, Jimmy, we still face a lot when it comes to the fears that can happen from going, from knowing your knowing your status, or even just going to a doctor, particularly as you highlight, for many of our, members of our community still.
Absolutely, absolutely. The questions and comments are coming in, and I just wanted to mention it as I see and observe in some of the comments. Dr. Sanchez, we know now things are different. I have a large part of the audience that's, as we used to say, a little bit seasoned. And back in the day, this treatment and with stigmas and people not going into treatment because they, didn't want anyone to know or not telling the family. And so there is a lot of mentioning of viewers who have lost family members. And so we just want to, uh-oh, did something happen? It looks like Dr. Sanchez went out. There she goes. There you go.
There we go. Sorry, something happened with my audio. I had to take off my mic.
Yeah, actually, a little we can hear you a little bit clearer now.
Okay.
But what I was saying was, I've noticed that people are naming that they did lose family members back in the day, and so I just want to hold space and say that we are thinking about that, and knowing that it is different now, but it wasn't then, because someone did mention for many back then it was a death sentence, and so we just wanted to hold that. One of the other things, Dr. Sanchez, is when you talk about healthy living and still having a healthy lifestyle, there is this term that I've become aware of called undetectable. And you referenced it a few minutes ago. And so can we talk about that? What is that status of being? Now, if I understand it right, the patient is positive for HIV, but the virus is not able to be detected in the blood. Is that correct? Or it's not at a level where it can be detected in the blood. Now, you're the physician, please. What did I miss there?
You got it, Jimmy. I think that we think about, HIV does not have a cure, at least not yet, right? But we know that we have medicines to eliminate the virus in the bloodstream, or sort of to really, we call that undetectable, meaning that when you take medicine or treatment for HIV, if you take it every day, after even just a few weeks, oftentimes, even people with new HIV, we see that we don't detect any virus in the bloodstream. And that is what's called undetectable, is that when we do a test, for levels of virus, it is undetectable, meaning that you do not have, as virus, like, in present or circulating in your bloodstream. And what that means is that, we mentioned earlier, right, how HIV transmits is that, when someone that's HIV negative, their blood comes into contact with body fluids of someone with detectable virus, right? So that is why if you are a person living with HIV, you take your medicine, you don't have any virus detected in your bloodstream, your body fluids are not going to have HIV virus to then transmit to someone else. And so undetectable is untransmittable. And that's often how we counsel our patients.
I just wanted, and we're going to take questions in about 2 or 3 minutes just because I see that there are a lot. But I wanted to put this one up here because you're sort of addressing it here again. And this is sort of personal. With as much prevention in ways, and again, I won't even just say with younger people, but my concern is that some might get a little lax. And so while we're talking about this, we just want to be sure that they're taking the utmost precautions, as Dr. Sanchez mentioned, condoms, taking your meds regularly. And so one question I'll ask in reference to this, and then I'll get to the others, but I can ask mine because I'm the host. Let's say, there's a relationship and there's someone who's HIV positive, but they're undetectable. Is it another layer of protection if that couple is going to stay together and that person who is negative is on PrEP? Is that an increased level of protection?
Yes, it is, because we think about you're basically using two different tools to prevent HIV. You're using HIV treatment as prevention because the person with HIV is on treatment and taking it every day and getting their care. And then the HIV negative partner is also on is also on preventive medicine to keep them from getting HIV, even if they were exposed to it. So, you're basically hitting it from two different points and using two different tools to keep keep the HIV negative partner from getting HIV.
Absolutely. We're getting ready to take questions. I have a few in here already. So let's go ahead and let me try to scroll up. All right. I think we have one of the questions was, has the opioid epidemic increased HIV AIDS diagnosis?
I mean, certainly we do see, we are seeing, we definitely do see new cases of HIV related to injection drug use. And here in Massachusetts for a few years, we've been following a cluster of new HIV diagnoses related to injection drug use. So certainly, injection drug use is one of the main contributing risk factors to new diagnoses of HIV. So definitely.
The Pastor Marion is asking Dr. Sanchez, what are the side effects of the presumably, and now let me ask this within this question, PrEP is not the med. Are there different medications that fall under the umbrella of PrEP?
Yes, there are a few, and they're very, very similar. They're similar medicines that are often used for people that actually are HIV, that do have HIV. We typically use one or two more medicines for people that actually have HIV. So that's why. So I would say that some of the more common side effects are often like nausea or kind of like that's actually some of the more common, or like some stomach upset that some people don't. That some people get from the medicine. That's oftentimes one of the more common ones.
And are there any, with some of the meds, you do have to be careful around side effects in general. But I remember hearing sometimes that there are more testing around the liver, LFTs,
Correct.
function tests with some of the meds, not only just for on PrEP, but those that are being treated as well, correct?
Well, I mean, typically for anyone who's starting HIV treatment, oftentimes we get labs as a baseline. And I think, we also counsel, I think one of the big, with PrEP, we often don't need sort of the liver, we often don't get as many tests, right? But I will say we do get kidney, we get HIV, STD status, hepatitis. That's the other one that we test for. But, what's important is often I tell people, alcohol use. So really being mindful around, alcohol use can affect your liver.
That's right.
And so, oftentimes I think it's something to be mindful of, with any medicine that you take. But that's often something I counsel on too, because it is rare to see liver effects. But oftentimes we think about what else can kind of, what else can affect your liver, and alcohol is sort of one of the other ones.
Absolutely. Absolutely. Heidi is asking, should people get to, and this is, this is a very interesting question. Should people get tested even if they are married or have a longtime partner?
Everyone should get tested at least once.
Once a year. Yeah, at least once. And then if you're active, I believe you did say at least once a year.
Correct. I would say if you're active and, having different partners, or, you at least once a year, and then perhaps even more often if you're actively injecting drugs, and, or again, like you're having sort of new partners, and, or not using condoms regularly. Yeah.
Dr. Sanchez, I remember again early on some years ago, this reference point. Can you touch on the virus being transmitted through birth? Because there, I remember, hearing studies, and the baby would come out, would test positive, when first born from the mom, and then 6 months later, the baby was testing negative either through treatment, or we understand that, sometimes the baby still has the mother's immune system. Or anyway, not going too deep, but can you, as the professional, touch
Yeah.
on it being the potential of it possibly being passed on through birth?
It can. HIV can be passed to a baby during pregnancy, childbirth, and/or breastfeeding or chest feeding. So that's, it's typically we lump into what we call perinatal transmission, and that's again related to the body fluids that I mentioned earlier. It can be transmitted through breast milk. It can be transmitted through blood, and and vaginal fluids, right? So those relate to sort of to this. We've dramatically seen we call that perinatal transmission. That has dramatically come down in the United States for a few big reasons. One of them is that anyone who's pregnant is tested for HIV often in the first trimester. And if they are at ongoing risk, right, depending on sort of, they might be repeated in the third trimester as well, because we know that knowing the HIV status is so important. And if that's if a pregnant woman or a pregnant person has HIV, we really sort of make sure that they're taking their HIV pregnant treatment as prescribed. And then oftentimes, depending on the situation, can also give HIV medicines to the baby for 4 to 6 weeks after birth. And the other piece that we counsel on is to avoid breastfeeding. So those are important points around some of this as well.
Thank you, Dr. Sanchez. One of the other things as you was talking, and not related, but kind of related to HIV. I think I had you on the last time we were talking a little bit of checking on monkeypox. And so it's so interesting that when we talk about it, I'm looking at some of the comments, and my aunt had mentioned, when I seen this, I just thought about monkeypox. There's a stigma still floating, people not understanding the medical drama face. They only look at the face of not being what they consider normal, though they don't look at it the same as someone who drinks daily, sickness, and treat the sickness. And so, that is a point as well. It's just so interesting in the peer education days, and looking how a lot of things have evolved, but then sort of the human end of it, we still got a little ways to go. One of the things that we did touch on, Dr. Sanchez, I don't see any more questions here, but I know this audience, they may pop up, and we just want to acknowledge Cindy Diggs from MGH, who was in the room, that did a lot of work. Her and I both in peer education back in the day. Cindy more involved in the HIV testing and treatment. But as I said before, and we touched on, Dr. Sanchez, it is very possible, and people are diagnosed with HIV and are living, and it's interesting to say the word normal, but living healthy lifestyles to where, outside of being told the diagnosis, getting into treatment, I believe so after treatment, if you get a diagnosis, you get into treatment and taking medication, and then you get to a status of being undetectable, correct?
Mm-hmm.
Okay.
Correct.
And just in that thought there, I know everybody is different, and we often say that Dr. Sanchez has not seen anyone on here, so any information given to questions is just general information. But generally, how long does it take someone to get to an undetectable status? Is that
usually?
Go ahead.
Usually, I think anywhere from like 4, even 4 weeks, like 4 to 6 weeks. Oftentimes we see people. Yeah, we have, again, newer drugs that work very effectively. And can really drop sort of, so I'd say anywhere from like 4, even like, from 4 to 8 weeks, like we already see people undetectable quite quickly. It oftentimes will depend. Many factors can affect that, like how high the virus was, how much time like you had been undiagnosed. So for example, that's why in some ways, again, the earlier that you get tested, the earlier that you know your status, the less that the virus has chewed away at your immune system. So all of those pieces contribute to that. But if caught early, medicines are quite effective, and we can bring down the virus level quite quickly.
One of the things that has really changed is I remember the term cocktails. That early on there were, folks were taking a lot of pills, and now it's really where some folks in treatment are taking what, 1 to 2 pills, maybe
1 to 2 pills, yeah. And
One to
and
two
they
pills.
and oftentimes very very minimal. It is very different from, as you mentioned, Jimmy, like the cocktails and the harsh side effects that we're seeing with sort of earlier treatment, and treatments that often weren't as effective as they are now.
Absolutely. We have one other question, and then I'm going to put a name on the screen, and I want to get your reaction to see, because this person really, I think, they're being transparent, had an influence on a lot of Black and brown people around the reality of HIV and AIDS. But Pastor Marion is asking, what is the difference between HIV and herpes?
So they are different. They're both viruses, but they're different viruses. So HIV is a human immunodeficiency virus that we're talking about mostly today. But herpes is another virus. It is sexually transmitted in a fairly common virus, like here in the United States, that often causes cold sores, both in the mouth and sort of mouth and sort of mucosa in the mouth, and it can also cause genital sores.
Thank you for that. This name I wanted to put in front of you, and I remember, now we might be a little bit different in age, Dr. Sanchez, but I remember sitting at a friend's house on the 3rd floor. They were in the attic bedroom. We were watching something on TV, and then boom, Magic Johnson came out and let us know that he was HIV positive. What do you remember that? And let's just talk about his being transparent made a major contribution to Black and brown folks really paying attention to this. And so when I seen the name pop up, I'm sure, it did not, take you by surprise per se, but do you remember that evening?
I do not. I think I was young. I might be on the younger. Uh, yes, I do not. But I have. I'm actually a big. I mean, I think that the history of the HIV epidemic is so important to us as infectious disease provide. I think it is always important to learn from what we as society and in the medical field and our patients have been through. So knowing knowing sort of the key individuals that really came out and stood out and sort of really boldly proclaimed sort of their status, has been a big part of what I've read and have heard from my mentors as well. I think, again, part of, I think public figures have been often so important in helping combat stigma. And I think that the reality that really anyone can get HIV, right? I mean, I think that, and that there are, that again, we have treatments, we have tools. It is so. I think it is always. I think, I think that oftentimes can be so influential.
That's right.
Because oftentimes we think about modeling and we think about people who, oftentimes sort of what I think about is, someone might say as a result of that, I'm going to get a test, or sort of basketball player that I admire sort of has come out, and so I'm going to similarly. So I think oftentimes we also turn to public figures as people that we either can identify with, or sort of, that kind of encourage us to similarly, get tested or sort of get treated.
Absolutely. To bring that more up to date, since you don't remember, Dr. Sanchez, I knew I was taking a risk, sort of asking that, but I just think about Idris Elba was the sort of similar to Magic Johnson. I remember when Idris came out and said that he was testing positive for COVID. That sort of changed the game for a lot of Black and brown folks, and we won't get into all the stuff that was going on earlier on with COVID. One last question around herpes. Is there a cure for herpes?
So no, I mean, there are antivirals as well. So similar, there are pills that people that are living with herpes take to really reduce the level of virus and reduce the rate of cold sores. So that way it's less likely that they'll transmit to someone else. And importantly, just, to avoid any symptoms from the cold sores or from, feeling sick.
This, Pastor Marion, you won it this morning. I remember Dr. Sanchez, false positives. I remember from artist within the faith community, was supposed to come to Boston, and he was saying he was positive, and then he got cured, and a lot of people had an issue with that and false positive and things like that. Is there such thing as a false positive? I remember a friend some years ago that was coming to me all scared and then came after and said, oh, it was a false, because there are different, there was so much back in the day that was just people were learning and unknown. But can we answer that question?
Yes. And the answer to that is yes. I mean, there are always, no test is perfect. That's sort of a big thing that we, that we learn, is that no test is perfect. And that oftentimes, even for HIV, we do sometimes see false positives. And so we often, repeat, oftentimes, there's repeat testing. So there's different types of HIV tests, and there's one that's done for screening. And then there's another one that's sort of, that often can confirm, and then the virus load. And so we have a combination of tests, and we use the different results to help us guide, is this a false positive? And, if we're, and when we should repeat a test, right? If there is concern about, if there's a question about whether it's a false positive or not. So yes, I think, we still see those rarely, but we see them.
One of the things I want to close with, and it's because, and I'm going to say that this info just came out, and we'll touch on it a little bit, but you said a few minutes ago that there wasn't a cure. However, the other day I woke up, and knowing that we're going to talk about this subject, when I heard it in the background, I kind of stopped and paid attention. CNN had shared that there's progress in a potential vaccine for HIV. And I just wanted to see if that's something you're aware of, and from your perspective, because as folks start hearing it in the news, we want to make sure that there's sort of a real layman's understanding of what's going on with that. Because Dr. Sandy, and again, it could be my youth worker orientation. I think when we just want to be sure that while we're sharing the information about the prevention, that it doesn't increase risk taking. I guess that's the way I would frame it. Again, it's probably from my youth, because this was, when I was a youth worker, this was really an issue, along with STIs, teenage pregnancy, and things like that. So sorry, it's coming back up.
No, of course. I mean, I think, I think that, so firstly, there is research underway for a vaccine to cure HIV. It's still fairly early, yes. Parts of research, but that is true. And I think there's very dedicated research in the hopes that we can someday have a vaccine, to sort of, treatment to cure HIV and potentially even perhaps prevent it. But, the vaccine was found to induce sort of, an immune response in the people who it was given to. But again, I think we still have years, we still do have, I think, years to come, for something more broad. And I think, again, a big part is, I think we are, part of what I see is sort of the importance of sort of these types of conversations is there's always going to be risks in the life that we live, right? I think that the importance, or, I think that, there are different kind of levels of risk, of tolerance of risk everyone has, in terms of what risks they are comfortable with, and sort of what risks are needed, or like what risks, what is it in life, right, that we want to, what gives us joy, right? I think that a part of our role is really understanding those risks, right? Like knowing that those risks exist, knowing where the risks are and what they are, and how we can mitigate that, how we can lower that risk. Because again, that's, I think, the big key thing is that we do have so many tools today to prevent HIV and to treat HIV, and to treat HIV to prevent others getting infected. So, I think that those tools are just so important. We really are in a different place. Again, not to underscore that, anyone, people, as we mentioned, there still is a lot of stigma attached to HIV, to sexually transmitted, so certainly, I think we always want to help people prevent, right, and any any disease, HIV, communicable diseases, chronic diseases, but we do have tools, to help people live long, healthy lives as well. And we commemorate, we, as mentioned, we commemorate with World AIDS Day so many lives lost to HIV around the world.
Dr. Sanchez, we have one last question before we get ready to wrap up. Teresa is asking, can there be variations of HIV in thinking about the possibility of a vaccine for HIV? Can it mutate? I remember hearing terms like resistance, if there's fluctuation with the, taking your meds. And so to Teresa's question, and again, Dr. Sanchez, doesn't have all of the research and in the lab right there right now, but can the virus sort of mutate in the context of it? And I mean, maybe I can answer because we haven't got the fully vaccine developed yet, but go ahead, Dr. Sanchez, this is your show.
Sure. So roughly speaking, there's two sort of strains like HIV-1 and HIV-2. So that, we often think of HIV as sort of those two. And most of what we see in the United States is HIV-1. And the other piece of the different strain is the importance that you just mentioned, Jimmy, that the virus can develop resistance through mutations, and so that's why it's so important. A few things like that's why for people who are on PrEP, what we mentioned earlier, we often first give them a test to make sure that they don't have HIV. Because they, so that's a really important piece, is that someone with HIV, we want to make sure that they're taking all of the treatment and they're taking it regularly, so that the virus doesn't, change or breed resistance.
Dr. Sanchez, you know what I just heard there? And again, I'm not saying just our young people, but everybody. If you don't, if you know somebody's on PrEP and you hear about it and you just think you're going to, can you give me a couple of, don't do that. I just heard that when you said that if you're not seeing a doctor, don't be taking your boy or your girl's PrEP, because you're trying to get ready for a rendezvous.
That is a great point, Jimmy. Again, we give, especially if you've been active, new partners, if you've been exposed to HIV, it is really important that, we have an HIV test. And oftentimes we might even repeat it in a month, like just to really make sure that you are HIV negative and that we're not putting any risk of you developing resistance, because PrEP is often one pill. For treatment, it's often two for treatment of HIV. And so by just taking that, basically, I think one of the big key takeaway pieces is that, you need to be in, proper treatment, sort of either to prevent HIV or to treat it, to avoid getting resistance. Otherwise, most people that we see that take medicine every day, we don't really see resistance. It would be very rare. It's not something that we see for the virus. Like once you get the virus under control and like you really lower it to undetectable, that would be extremely rare for it to change, because you really are keeping it under control. It's not sort of, it's not living in your blood. It's not mutating, or sort of, it's kind of kept quiet when you're on treatment.
I have to, my mother is just so informed. It was funny because I thought about the commercials. They're just commercials for Dovato, and we're not naming, or I think it's Travato, but we're not naming, we're not endorsing or anything. We're just saying that my mother referenced to it. I love to see this. Debbie Stubbs is saying new health plan, new doctor, and did a complete blood work. And when I checked on my chart, HIV was one of the tests that she did in my blood, and it was negative. And so what that indicates there is the primary care doctor is doing that screening to which you preferred, so that that was good to see that, from the primary care physician. Yeah. Dr. Sanchez, thank you so much. I really appreciate you coming in. I'm sure this won't be your last time. We'll get you to come in again. Please.
I hope not.
No, not at all.
Always a pleasure.
One of these days, and we do a live in person, we want to have you come and we can get the hug and
oh, yeah.
Yes. But please give Dr. Basola and everyone there, Dr. Hall as well.
Yes.
Doing some stuff with her as well in a different vein there. So thank you again so much for spending time with us this morning to update us about HIV and AIDS in 2022, because as we learned today, it is very, very, very different. Dr. Sanchez, I'm going to let you go and share with everyone our next episode 2 weeks from now.
I will do. Thank you so much for having me.
Thank you, Dr. Sanchez.
Bye.
Have a great day. Bye-bye.
Bye.
Again, another wonderful comprehensive session with one of our faculty and staff from Massachusetts General Hospital. We're going to come back 2 weeks from today. And I'll be very honest, we were struggling because there's an increase in RSV, but then also World AIDS Day was on Thursday. And so we sort of made a decision to discuss HIV and AIDS this week, but 2 weeks from today, we have someone that is going to come talk with us about the main topic is going to be RSV. We know that there's an increase with our children, adults are getting it as well. And there are hospitalizations across the country. We're also going to do a minimal update about COVID and the vaccination as well. And so that's going to take place on Tuesday. Today's the 6th, Tuesday, December 20th, 2022, because we're not in 23 yet. So please plan to come back with us to join us for that session and share and let parents know that session is taking place. So you got a 2-week notice to come back and hear more information, hear updated information about RSV, some COVID, and the vaccination for COVID as well. I think that's it for me. Tomorrow morning on Java with Jimmy, we are going to have Director Henry Santana from the city of Boston is going to come and chat with us about an initiative they actually probably in the process of launching right now. And so he'll be with us tomorrow morning at 9 a.m. Thank you all for tuning in today. And Teresa, it's interesting because I was reading Debbie's comment and I had that same thought as well. And so maybe there was a consent and just, they give us all those papers in the hospital. And sometimes we just think we know what they say and we just skim them. I know I have before. But thank you all for tuning in today, and we'll see you tomorrow at 9 a.m. All right, everybody. Peace. Thank you.